Hi everybody, I'm proud to present during the SAR Congress some information that we gathered about the practice of acupuncture in Europe during the lockdowns of COVID-19. It's a preliminary information, so don't take it as a fully validated, but still I think the trends are right and what we conclude from it is actually in the right way. And the reason I started to deal with this information was to look deeper into the big question what we can draw from and learn from how acupuncture was practiced or not practiced during the lockdown. So this was a survey from 9 countries, and I asked also the participants to put information if it's what kind of legality Chinese medicine or acupuncture has, and also could physiotherapists practice or not as a kind of control group that has a legal status in all countries. So we can see basically that we can look at acupuncture was regulated in some countries, so they could or couldn't practice, we'll see. And in some countries, acupuncture is not regulated. And in these countries, in many places, the acupuncture couldn't be practiced during the lockdowns, but in some it could be practiced. And this is actually was the first focus for me, So we have acupuncture not regulated officially, but still the practitioners could practice. And I want to know what we can draw from it for the people who couldn't practice, for the associations that couldn't practice. And we compared it to the physiotherapist. So the first lockdown was very panicky and very unusual. So we can see acupuncture was regulated in Austria and in Portugal. And in Austria they could practice, we'll see why, and in Portugal not. But there was a very interesting situation, like in Finland and UK, they could really practice, or they self-regulated themselves because acupuncture was not regarded or not regulated by the official bodies, medical and others. So let's have a look at it like this. For example, Finland was a good example that theoretically acupuncturists could practice, but there was no official direction, actually from lack of accountability. But on the other hand, the association itself, FinnAcu, decided and recommended a temporary closure of clinics, especially until things got clearer and until they could give a clearer instruction. So the acupuncturists in that country, that part of FinnAcu, were actually guided or self-regulated by FinnAcu. The same is actually was the situation in the UK by the BACC. So in an official way, it's less regarded as part of the common law to practice acupuncture. But what we could see at the first lockdown, that different bodies, and especially we're talking about association, permitted opening of clinics in different times and subsequently in different ways. So they actually self-regulated by themselves, the acupuncturists who are part of these associations. In Austria, it's very different because it's only MDs that can practice, and MDs, that was essential primary care, so they could continue to practice acupuncture. In Portugal, by the way, when it's regulated, both acupuncturists and physiotherapists couldn't practice during the first lockdown, but later it's changed. So we see the same applies to both. So what we can learn from it? So we can learn basically that there is 3 categories. There is one that couldn't practice. In most places, it was due to the panic, and it was actually quite all across Europe. Some associations were self-regulating themselves, and some places could practice all the time, especially because the members were MDs, so they just were allowed to practice as medical doctors. So one of the take-home message from the first lockdown to me is the self-regulating model by associations, which is a very interesting model that maybe we can carry and take with us to the future. Now the second lockdown behaved a little different. And I would like to look at some association that could practice, although they were not regulated, and some association that couldn't. And again, see what we can learn from this unusual situation. So we can see basically three models. There is a model of legal acceptance, where acupuncture is accepted to practice it's within the legal system. In Belgium, for example, it was open, but it's mainly the nurses, physiotherapists, and MDs who are practicing acupuncture. So it's not legal, but it's recognized, we can say. In Austria, as I mentioned before, and in Spain, there was a different situation that actually medical centers with MD could practice, but acupuncturists couldn't. So we have a kind of different legal acceptance. Then we have different legal acceptance and recognition, like in Portugal. So in Portugal, basically, acupuncturists are recognized that they could practice, and at the same time was the same as physiotherapists. And this is different from the first group, where it's more restricted to medical or paramedical. So acupuncturists are not just practicing acupuncture, but they are usually part of like being a nurse, being a physio, or an MD. But there's this third category, which really is most interesting to me at this point, is places where acupuncture is not fully regulated by the authorities, but with a lot of lobbying, they manage to practice and acknowledge to be practiced during the second lockdown. So in Israel, in Norway, and in the UK, that was the situation. So we're looking here at three models during the second lockdown. Places where acupuncture is practiced by medical and paramedical. Places where there is a legal acceptance and recognition. Portugal is quite unusual in it. And places that could lobby. But on the other hand, we got a place where there is no fully legal recognition, although acupuncture is a profession which is allowed. It was the Netherlands. So they couldn't practice during the second lockdown, and they were kind of grouped under all the camp therapists together with hairdressers, with tattoo shops, and all this was not allowed to practice. And so there was no effective lobbying, and there's no full legal acceptance, and that meant that acupuncturists actually couldn't practice in the Netherlands during the second lockdown, where in other places, as I said, that fall into other categories, they could practice. So this lobbying idea and lobbying model, I think it's something to learn from, because it's a grassroots movement that came from the association, like in Norway, in Israel, and in the UK, and in Belgium. And I think if we take lobbying as an important factor, there are three things that are needed. First of all, is strong leadership and people who are very committed. People who are able also to communicate with the political issues, have to use and utilize advocacy, and utilize connections. It's always important. Eventually, you need also to create a strategy and to build. And sometimes it is advisable even to build a group of interested people. It can be patients who have a lot of connections politically and ability to lobby for you and to advocate for Chinese medicine. And it can be other even well kind of paid PR. And the last way, of course, for integrating acupuncture into the medical system and then for being acknowledged in Israel is a very good model for it, is to promote research and work within the hospital and the HMO system. And then even if you are not fully legally accepted, the attention to the profession is very serious, and therefore the lobbying gets a serious reaction. So as a final note, one of the two things I think that are the beginning of taking home messages from the lockdowns. One is that TCM has few models of recognition, and in Europe it creates a lot of challenges. And I think all associations should consider self-regulation and not just wait for external regulation. And lastly, that strategic lobbying should be active all the time, not just to wait to lockdowns and to COVID and to unusual situation. So thank you very much. I hope you got something out of it, and there's some home messages that will carry us to the future. Wishing you all the best of health and healing. Thank you very much, Yair.